Ed Lancer.
All right, Nick, thank you. Joining us now, the director of the Harvard Global Health Institute, Dr. Ashish Jha, and the former CDC disease detective, CNN medical analyst, Dr. Seema Yasmin. Dr. Jha, let's get your reaction to these new guidelines regarding religious institutions across the country. What's your reaction?
Yes, well, thanks for having me on. Obviously, houses of worship have a very special role in our society and have to be treated, I think, a bit differently in terms of offering protections. These guidelines, as I looked at them, and when I compared them to the guidelines that the CDC had initially put together, the ones that were shelved by the White House a couple of weeks ago, and these are really, I think, much more watered down. And I think don't offer the level of guidance that houses of worship really need. In my mind, the issue here isn't governors or the president who gets to win. It's how do we open up these services and these houses safely for congregants? And I just don't know that I see enough details in the CDC guidelines to really give me confidence.
Oh, Dr. Yasmin, should we feel comfortable going to a church, a synagogue, a mosque, or other house of worship right now?
Well, look, Wolf, I'm Muslim. Tomorrow is Eid, the most celebratory day of the year for Muslims. And the normal way to celebrate is with lots of food and lots of people. And there's nothing that I would love to do more than that. But I think even as states and some state officials rush to reopen, it's on us to make smart and safe decisions. And that means looking at the data. And if you do look at the numbers, you'll see that on Thursday, more than 20,000 Americans were infected. And then the day after that, so just yesterday, that number went up, and there were more than 24,000 Americans newly diagnosed with COVID-19. The numbers are not yet going in the right direction nationally. Plus, there are states like North Carolina and Arkansas that are seeing real spikes too. So for me, I'd love to go out to eat food and be with my community, but the most sensible, safe thing is for me to stay at home with my dog and celebrate Eid virtually, because I don't want to become infected. And more than that, because I feel fine. And we know that with this coronavirus, you can feel fine and still be infectious. And I don't want to do anything to endanger my community. So for me, it does not feel safe for us to be rushing back to houses of worship, whether that's a synagogue, a mosque, or a church, or wherever that might be. We have to think about public health.
You agree, Dr. Jha?
I do. And, we really do have to let data drive this. And obviously, there are some places in the country with very low number of cases, Montana, Wyoming, Vermont, where it may be safer to have much of the congregation back. And there are safe ways to open up churches and mosques and synagogues, but it's not to pack folks in because we don't want houses of worship to become places where people get sick. And so I think we really have to let science and evidence drive our decision-making on this.
Dr. Yasmin, we've seen significant crowds gathering at beaches today, and I assume bigger crowds tomorrow and Monday during this Memorial Day holiday weekend. So many of these people are not wearing masks. They're not even social distancing. You're an expert. What's your message to these people?
So before you go to the beach, think ahead about all of the things that you'd need to do to keep yourself safe. You're going to need a mask. You're going to think about physical distancing, and not just on the beach. You may need to go to a restaurant. You may need to use a public bathroom. And in those confined spaces, it's even hard to do physical distancing. So I understand the need to get out of the house, but you have to stay away from those crowds. Keep in mind things like sweating, sunscreen, and getting seawater on your mask means it won't work. So it's just a lot harder than being in your back garden where you can control the environment. It's more difficult to stay safe in these crowded public spaces. And I will say one more thing about testing and the number of positive cases, Wolf, because just a few days ago, we found out that the CDC and some states like Texas are muddling together antibody test results with the PCR virus test results. So this means we don't actually have an accurate picture of how many positive and negative test results there have truly been. And that sets us back a bit, and it makes it trickier to figure out exactly where we are and what our testing capacity is.
Dr. Jha, in Montgomery, Alabama, they just reported that they have one ICU bed available earlier this week, and they're having to send sick patients to Birmingham, Alabama, about 90 miles away. What do you think is going on here?
Yeah, so Wolf, when the outbreak really got going in the United States, it was largely on the coast, New York, Miami, in Washington State. And one of the things that we've all been saying is that it doesn't stay on the coast, that it will eventually make its way to the rest of the country. And there are places where the outbreak is still just, it's going up. And Alabama, really, and Arkansas and North Carolina look like some of those places. So this is worrisome, obviously, and I think we have to pay close attention, and we really have to continue to maintain social distancing and ramp up testing and do all the things to bring the disease under control.
We are so grateful to both of you for your expertise. We always are a little bit smarter after these conversations than we were going into the conversations. Dr. Ashish Jha, Dr. Seema Yasmin, appreciate it very much. Stay safe out there. Thank you for joining us.
Thank you.